Think about all those people suffering from it's not a big deal.
Generalized anxiety disorder is a widespread mental illness that affects more than 20% of the US population, more than 5% of the Chinese population, and around 5% of the Canadian population. GAD is characterized by a persistent and excessive worry about a number of things, and is more commonly known as the inability to be calmed, and can make it extremely difficult for individuals to function normally on a daily basis. GAD can be roughly diagnosed when a person excessively worries over more or less trivial matters for longer than 6 months. Physical symptoms include muscular tensions, sleeping issues, irritability, fatigue and exhaustion, repeated stomach aches or diarrhea, sweaty palms, shaking, and rapid heartbeat. If these symptoms apply to you or an individual around you, please do not downplay the situation.
Some might say that this disorder is simply an excuse and not as bad as they make it out to be, because everyone feels anxious when they're stressed. Be careful for individuals suffering from anxiety. The anxious feeling lingers every day. It is an uncontrollable, excessive, unrelenting, emotionally unpredictable, and mentally crippling disorder, centered on expecting the worst in every situation, even with the absence of reason.
If this applies to you, please take the time to visit someone that will be able to help, a psychiatrist or a doctor at a local clinic. Treatment that can apply include supportive or group therapies, SSRI, which stands for Selective Serotonin Reuptake Inhibitors, helps to alleviate stress by manipulating the serotonin levels in the brain. CBT, which stands for Cognitive Behavioral Treatment, involves a process that helps to organize a patient's ability to be aware of their own thinking, including logical, emotional, and behavioral thoughts. This treatment engages the patient to reflect upon a stressful event or previous traumatizing experiences. Treatment for patients with less severe GAD symptoms include relaxation training, meditations, and stress management courses. After all, with GAD, although some people, particularly women, have a higher chance of getting it, it is doubtless that there is a possibility that anyone could become diagnosed with it. If you are, it is important that you do not see this as a sign of weakness or some sort of deficiency. It is totally okay. You don't have to be ashamed of it. Make sure to seek for help or at least advice, even if you don't think it is really necessary. It is always better to prevent it instead of waiting to deal with it afterwards.